I deal with a lot of men that have urinary hesitancy, which means when they try to urinate, they can't fully empty their bladder, so they have to go multiple times a day, and it's very, very annoying. I'm gonna show you 3 things that you can do immediately to try and improve your symptoms. My name is Philippe Schafer. I'm a physical therapist in New York City, and I specialize in orthopedic, sports, and pelvic health physical therapy for men. So essentially, when you're trying to urinate and you can't fully empty your bladder, things are probably pretty stiff in your pelvic floor. So you have to loosen them up. So one of the things you can do is a breathing technique. So when you breathe, during the inhalation, your pelvic floor on the bottom expands. And when it expands, it's essentially stretching. So you have to learn how to relax it. So when you pee, everything's relaxed and you can fully empty your bladder. So the first thing is a breathing technique. You fully breathe in, and then breathe out. Breathe in, breathe out. So you can see your chest expands, your ribs expand out to the side, and your pelvic floor also expands. So during that exercise, you want to see if you can feel your pelvic floor relaxing. And if you do that, let's say 10 or 20 times a day, maybe a few times a day, it might improve your symptoms. Second, similar to that, you want to try and do a reverse kegel. So a kegel is you do a pelvic floor contraction. You're shortening the muscle and you're squeezing it, and essentially the purpose of that is to make it stronger. So there are kegels and then there are reverse kegels. A reverse kegel is if you're trying to do a bowel movement and you're trying to push a bowel movement out. A reverse kegel is you're lengthening the muscles to do that. So what you do is you do a bear down kind of motion. You're pushing down like you're trying to do that. And you can feel, most people can feel the pelvic floor expand or lengthen, and you want to lightly do it. You don't want to push too much. You don't want to strain because that can make things maybe a little bit worse if you push too hard, but you want to feel very gently the muscles lengthen, and essentially you're stretching out the pelvic floor in a sort of way. So you do that, you push, you bear down, and you hold it for a few seconds, and then you relax. If you do that, we'll say 3 by 10 each day, that also can help your symptoms. One thing you can also do is you can combine the breathing with the bearing down. So if you're doing the breathing and you can't feel your pelvic floor relax and expand, you can do a little bit of a bear down motion with the inhalation, just so you can feel exactly what it feels like if you are not doing the bearing down. Again, during the breathing, you want to get to the point where you're not consciously contracting or pushing down on your pelvic floor. You want to feel it fully relaxed, but you can do the reverse kegel or the bearing down to help you feel what it should feel like. Third, there's a bunch of stretches that you can do to help loosen everything up, and I'm going to show you a few of them. The first one is using a chair. It's a stretch for the hip flexors, because if these muscles are really tight, it's hard to relax, hard to fully empty your bladder. So how you do it is you put your foot right here, one foot there, and then you feel the stretch right here. If you want also, you can lean to the side like this, and you'll feel a stretch right in there also. Oof. The next stretch is for your deep hip internal rotators. There's a bunch of muscles that are underneath the glute max. So you just cross your legs like this, and then you lean forward and you'll feel it in your glutes. The next one is a groin stretch for the adductors, because the inner thigh runs up and attaches to the pubic bone, which a lot of the pelvic floor muscles attach to as well. So if the groin is tight, the pelvic floor is affected as well, and this can also help loosen things up. So you just take a band like this, and you stretch to the side. So that's 3 things you can do immediately. It's breathing, reverse kegels, and a few stretches. And for a lot of people, it really helps. If it doesn't, I give free 15-minute consultations, and my information is in the description below. Just contact me and we can figure out some more strategies to help you.